Oh, there it is, recording in progress. So the recording will be up on our private YouTube channel from our website at Care and Support West. So good morning, everybody. My name's Angela Roberts and I'm Deputy CEO at Care and Support West, and you're all very welcome this morning. This is our workshop on staff decompression and recuperation, and I'll welcome our speaker, Frank Noble, shortly. A couple of parish notices from me. After today, our next workshop is on the 14th of July, also at 10 o'clock. And on that one, we will have 3 of our commercial partners to talk to us through energy savings. And I'm sure everyone's interested in energy savings, right? And that will be Zenergy. Following that, Towergate will talk to us about the key relating to renewing your insurance policy. I think we're all aware of the insurance complications related to the last year or so. And finally, Citation will talk about the very important and very vexed subject of recruitment and retention. If the person in your organisation needs to know about these things, energy savings, insurance or recruitment and retention isn't you, then could you please let your relevant colleague know? And to sign up, please go to our website under the events page. While you're there, you'll also want to have a look at the information relating to our big current project on better security, better care. This all relates to the DSPT, which is the Digital Security Protection Toolkit, which I'm hoping many of you will already have heard about and may be engaged with. We're running a different events to enable you to get engaged with BSBC. So please do have a look at that. Sorry, I'm multitasking now, admitting new people. In holding this work, we here at Care and Support West are underlining our recognition of the need for staff wellbeing to be supported, recognised and supported. And we know that you're all keen to find out more about what you can do. So to open the session, I'd like to invite Sandra Payne, who is Brunel Care's Director of Nursing and Care Homes, to tell us about their experience of using the St Peter's Hospice Decompression and Recuperation tool. Sandra, over to you. Thank you.
Thank you, Angie. Hello, everybody. Nice to see you all. Yes, I've been asked to come and speak to you about our experience of using Frank's very useful decompression tool that we have labelled Pause, Reflect and Renew. So if I talk about my personal experience rather than the more of an organisation-wide experience, so I oversee a group of 7 care homes, 5 care homes and 2 reablement centres. So I have a group of managers in each of those centres, and I also have 3 colleagues who work with me overseeing those centres. So I decided that I would use Frank's decompression model within our care home management team meeting, so that we already had a format there set that we were going to meet, and this was our first face-to-face meeting since COVID. And I also had a few new managers in the room, so it was a really good opportunity for some team building. So we had our regular meeting and our regular catch up, and I slotted in our decompression towards the end of the meeting. And I started off the decompression work by talking about my experience of coping with COVID. And it's been a really hard, as everybody knows, a really hard 16 months or so, hasn't it? And so I talked about how that had affected me in a work role, how I'd managed. I'd had some personal bereavements during that time as well. So I shared some of that. And I think it's important to underline how informal that sharing was. There was no set format. I shared what I was happy to share. And it was interesting to see people's reaction to that sharing. And I think because I started it off and I shared quite openly quite a number of things, then I invited the other people that were in the meeting, the other managers, to start sharing their experiences as well. And it wasn't, I didn't pinpoint people. I didn't say, you know, Sally, you talk next. It was a very, people kind of jumped in with their experiences. And I think what was really telling was that people shared things that, and I like to pride myself in that I'm out and about in all of the homes, and I know what goes on, but things that people shared I didn't know. So it was really, really interesting and really valuable. I think the team really appreciated it. I know the team really appreciated it because they told me afterwards. And some of the team didn't want to share, but they got real value out of just listening and just being there and being part of it. And I think that needs to be appreciated too. And I don't think you can underestimate the impact of doing this. For some people who didn't want to share, it was because there was so much within, not just of what had happened in the last 16 months, but it opens up other channels as well. So I think it's okay for people not to verbally share, but just to be part of the experience is really, really valuable. And I would say it is the best team meeting I've held ever, because everybody engaged, whether they were listening or whether they were verbally contributing. And the feedback afterwards was like, it was like a family reunion. And there was a mutual respect in the room. There was an understanding. It was really, really valuable. It really helped with team building. So that's how useful I found it. It's rolled out across the organization, but just from my personal experience in my area, that's how useful I found the experience. And just for it not to have that structure and to be very informal, was key, I think. So yeah, so that's my experience. So over to you.
Thank you, Sandra. Thank you. That's great. I think for people, it's the best team meeting ever. It's marvelous. It's just really great, especially in these such difficult times that we're working in. So thank you very much. So on that very positive and uplifting note, I'd like to hand over to Frank Noble from St. Peter's Hospice to talk about the staff decompression and recuperation tool. And there will be plenty of opportunity later for questions and interaction with Frank. If you've got any questions in the meantime, I will look to pick them up from the chat box. But for now, I'll hand over to Frank. Thank you.
Yeah, thanks, Angela. Sandra, that was really interesting and actually mirrors my own personal experience here. We had an exec meeting last week that I'll tell you about it. Probably the best exec meeting I've been part of. So, morning, everyone. I'm Frank. I'm up at Brentry at the moment, just off Southmead in the hospice, and I'm the CEO. I've been the CEO for nearly 2 years, actually. If anyone had told me that I was going to come through a pandemic, I probably wouldn't have taken it. But there you go. You end up with these things. I've got a relatively short presentation. I'm going to talk for a little bit without slides, and then I'm going to start some slides if I can make the technology work, and then take you through that. But my intention is just to share with you what we've been doing at St. Peter's around recuperation, decompression. It's offered in a very open way for you to do with as you wish, and I hope it's of use to you. I should start by declaring a personal interest. I'm one of those in the military that likes to start meetings on time. So well done, Angela. 32 years in the army with rather too many friends, living with the effects of prolonged, intense operational pressure and stress. So I'm still living with it. When I was first asked to talk on this subject, I thought, well, it's always good to start with a story. I might start with a story, but I'm always a bit nervous using my own stories. I was chatting to my wife, Debbie, and she said, well, why don't you use one of mine? So if you don't mind, I'm just going to start off with one of Debbie's stories, because she was in the army as well. The year was 2000. The place was Sierra Leone. And those of you that remember the news at that time might remember West Side Boys and these other rebels. And if you've watched Blood Diamonds, you'll know exactly what I'm talking about, the film. The country was being overrun by rebels. But they weren't political. They were just after the diamonds. And they had a particular form of terror where they would come into a village or a town, take a random selection of people of all ages, all sizes, all sexes, all creeds, and then tell them to choose between short sleeves and long sleeves, and they'd chop their arm off. Well, in fact, often both arms. The country was overrun, and the rebels were on the outskirts of Freetown when the British government decided to intervene. So I was at work, got a phone call at 10 in the morning, and 10 o'clock that night, I put Debbie on a plane out of Heathrow, and she deployed with a British brigade for 6 months, and she was in the media role. and this was before mobile phones. I won't talk about the deployment at all. If you've watched Blood Diamonds, you'll know what I'm talking about, but she was part of the unit that liberated the Sierra Leone blind school. Obviously a school for kids, half of which had been blinded by rebels and half of which were naturally blind. On return, she flew straight back into Heathrow again. There was absolutely no decompression at all and was sent home straight on leave. Sometimes catches me that. So it's fair to say that she spent 12 months self-medicating. God, blimey. Just one sec.
Okay, Frank, take your time.
Yeah, so she spent 12 months self-medicating, mostly with the people that she'd been on tour with. Found it very difficult to just get past it. What was interesting is the most difficult part for her was supermarkets, bizarrely, because she found it very difficult to watch people being a bit difficult over such normal stuff when there were difficult things going on around the world. And there were a couple of times when she intervened on behalf of supermarket workers who were maybe being hassled by members of staff, and she realized she had to stop going. So she did, she stopped going to supermarkets. We made our peace with that tour by helping to organize a choir tour of the UK. 35 of these kids came over to the UK and did a singing tour, which was amazing. And we provided financial support for 10 years. The question I often ask myself is, I wonder what would have happened if we hadn't recognized the problem and done something to address it. It's not always done badly. I visited Afghanistan 3 times, and the British Army was doing decompression quite well at that point. On the way back, you'd spend a day in country in a relatively safe place where you get used to the fact you were no longer under that pressure. You'd spend 2 or 3 days in Cyprus doing the sorts of things that we're about to talk about. And you'd then spend 2 weeks in your normal place of work. You weren't allowed to go straight on leave. You had to do some really normal work at very low levels of intensity. And then eventually you were allowed to go on leave. And of course, the other thing was all the individual support was available. And obviously, if you needed to be signposted to it, you were. So where are we at St. Peter's? Well, I suspect we're in exactly the same place as everyone on this call. We've had a mix of frontline, inpatient community teams, the support teams. We've had guys working from home, guys on furlough, and guys shielding. For some people, it's been utterly relentless and still is. For some people, for example, our retail teams, it's been a roller coaster where they've opened, closed, opened and closed. For others, it has been exceedingly boring. Folks shielding, for example. What we're experiencing is people emotionally tired and exhausted. We're experiencing a lot of tears, a lack of patience and empathy in people that would normally exude empathy. And we're experiencing resentment between teams where maybe teams feel that they've done more than others. We have lots of support for individuals. We have Wellbeing scheme program. We have employee assistance. We have clinical supervision. But we were sat back in January thinking about this, realizing that this was now pretty serious. And we felt that we needed to do something above and beyond those programs. And that's what I'm about to talk you through. So I'm hoping I can make the technology work. And I'm hoping you can see.
We can.
This slide. Excellent.
Yeah, that's it.
So I'm just going to talk you through what we've been doing. We call it a framework, recuperation, decompression. It's not a set program. And as it was really interesting to listen to Sandra, actually, because it absolutely does not have prescribed formats. So it's not, you have to do this 3 times and it has to be 60 minutes and this is the agenda. There's nothing like that at all. It's been entirely flexible. But the idea is that we're providing a space for our teams. And this is, I should start by saying this is very much around teams. And we're providing a framework for our teams to recharge, restore, recuperate, get over what they've been through, the intense, prolonged period of activity, pressure, stress, anxiety But most importantly, this is about helping people to be able to face the future. It is fundamentally about teams. It's not about mixed teams. This doesn't work well with mixed teams, and I'm very happy to talk about that in questions if people would like. And it does work alongside wellbeing, employee assistance, clinical supervision, etc. It's applicable to everybody. It's not a frontline thing. It's absolutely applicable to all people and all teams. So we give managers really do need the discretion to do this where, when, what, how often they want to. It needs to fit their team, what their team has experienced, for how long they've experienced it, and what are their opportunities for recuperation. So, for example, if you're on a shift, you've got very different opportunities to do this than if you're a kind of 9 to 5 back office team. Really important that the whole team participates. Now, that's really tricky. We have the same challenges here with clinical teams that are in the community or the advice line where there's always someone on 24/7. But there are often ways to get around that. But it's really important that as far as possible, the whole team participates as they would for any other team meeting. There are 6 things that that this loose framework has. And the first one is reflection. In fact, Sandra was giving an example earlier. And this is about the team. Remember, this is all about the team reflecting on their experience as a team. What felt good, what was not good, what went well, what didn't go well. How does it feel? The second one is learning. And that's very much around, again, that's about the team. And it's about how did things go for the team? So all organizations do learning, which is fantastic, but learning is often focused around the services that we provide. Whereas this is really focused on the team and how the team have been together and how they might improve. The third one is recognizing and celebrating. Now, all good organizations do that. We do that, but this is about the team recognizing and celebrating within the team for themselves, by themselves. The most important one, I think, personally, in my view, which is why I put a couple of asterisks against it, is the social and recreational. And this is inside and outside the working time and the workplace to suit the manager and to suit the team. But the reason I think it's the most important is that in most social and recreational activities I've seen, people reflect, learn, and celebrate all at the same time. And so you're going to get a multiplier effect. Working at lower place, this normally generates some conversation. How on earth are we going to do that? Because we've got the day job to do, and that's fair enough. But in my experience, most people find a way of taking some of the pressure off people. And then, of course, annual leave, which is an important part of it. So just to give you a bit of a feedback from St. Peter's, so reflections and learning, managers have been arranging these in different ways. Some have been doing it during the break. So, for example, the inpatient team, some do it in existing meetings like Sandra was talking about. In fact, we've been doing that in exec, where we'll separate a bit of recuperation, decompression from the normal meeting. And some people have done it as just separate activities. Couple of examples. So community nurse specialist teams, we've got 3 out there in the community at the moment. And one of the teams got together and the team manager said, look, bring whatever idea you want to the meeting. There's no format. We're going to have a bit of learning, bit of reflecting, bring whatever you want to. And one of the nurses turned up with a plumbing set, copper pipe, valve, wrenches and all that sort of stuff, and gave it a short lesson on how to create a valve. But the point was actually quite profound. And what the nurse went on to say was, if you create this valve and you let the pressure off too quickly, the pressure flies through the system and blows the system somewhere else. So you've actually got to let the pressure off slowly, which I thought was great. Forehead charades was another one where people were asked to put on yellow stickies, how they've been feeling. They then had to pick one up blind, put it on their forehead, and then everyone had to kind of help them guess what the feeling was. The other one I liked was one strength, where they again, yellow stickies, and they took everyone in turn and they said, right, everyone write one strength for this person here. And then that person had to read out those strengths. They weren't allowed to be coy. They weren't allowed to be shy. They had to be open in accepting and embracing the strengths that were being offered to them. And then obviously open spaces, whatever you like. So there's a few examples of reflection learning. And I would say that some teams have done a lot more reflecting than others through the pandemic. And so the medics got together the other day, and the medical director said, right, let's start with a bit of reflection. And they said, we'd rather not. We've done endless reflection. And yet other teams that haven't really been together much have really embraced it as a great opportunity in the way that Sandra spoke about. Recognizing and celebrating achievements. Again, this is about the teams. This is not about the organization. Some examples we've had are one-to-one thank yous and also anonymous thank yous. An example is this. I got this left on my desk about 10 days ago, actually, and all it says on the back is thank you. I've got no idea who it's from, and I've got no idea why. And when someone came up with that as an idea, I thought, that's a bit weird. You know, you're going to get a thank you from someone you don't know and you don't know why. But you know what? It's absolutely brilliant, because you think about it every day. Whereas if someone sends you a little note or catches you in the corridor and says, thank you for that, it's great, that's lovely, but it's done, it's finished, and it's gone. But an anonymous thank you goes on and on and on. It's a gift that keeps on giving. We've got other teams that ring bells. Income generators, for example, when they achieve things, they've brought a bell into work, they now ring it. Spontaneous acts of kindness, where people just come up with something spontaneous. And of course, we're a hospice, so we eat lots of cake. Social and recreational. This, I think, is the most important one. And the really important thing here is that we're giving permission to our managers and our teams to do this inside the working day. Now, obviously, the different teams have different opportunities to do this, but there's lots of creativity coming out here. Quizzes, walks, we've got lovely gardens, people are doing picnics in the gardens. Our hospice at home team are sending all of their, they're not doing it in one go, they're doing it in 3 goes, where they're going to send all their folks down to one of the Bristol theatres that are now offering individual dance lessons. And at the end of it, they're going to make a TikTok lesson video. Obviously, we've got folks going to the pub. In fact, the CNS team that did that meeting where they did the copper pipe, at the end of it, they just said, sod it, let's all go to the pub. And the fundraising team, I think next week, they're going to be in Ashton Court, where they're going to do a picnic and they're just going to play rounders. That's the thing they want to do. And that's what they're going to do. So happy to talk about a few more of those, but those are some of the examples of what the guys have been coming up with here. The most important resource is time. And I know it's the most difficult for organizations, but it is the most important resource. Managers and the teams need permission to do this within the working time. This is not an evening or a weekend thing, but they must have the flexibility to fit this around their schedule. It's not something that you can organize centrally. Obviously, some of it depends on the unwinding of social distancing, such as, you know, how many people you can meet up and all that sort of stuff. But it must be for managers and teams to organize this themselves, but they need the permission to do it. One of the really important points is that all of those things that we've talked about, you could just get on and do. But in my experience, and we are finding it here, that by telling everybody that we are entering a period of recuperation, decompression, those activities that we do, it's almost like a multiplier effect. I mean, you could go and have a picnic in the garden any day you like, but if people know that it's part of a recuperation and decompression period, it has a much more powerful effect. So people do need to know when that started and finished. And at St. Peter's, we started in early May. We issued a simple Word document as guidance. Obviously, that then gives permission for managers to take the time. And we were encouraging reflection and learning over May and June, and social recreational over July and August. It's been a lot more mixed than that. It's been up to teams, but we will draw it to a close. So by the end of August, early September, we will draw the whole thing to a close, and that period will end. I should say, we've also put some money to it. Not something that we like to do very often, spend charity money on staff socials. It's something that we find difficult and we don't do very often. But we spoke to the trustees and we said this is pretty exceptional, and we have put we've put an amount of money aside per person for paid employees, and they can draw on it as often as they like, up to a total. So if they want to spend it all in one go, that's great. But if they want to spend it over 2 or 3 events, that's also great. They're not allowed to take it as cash or spend it on alcohol. That's the only 2 stipulations. The most important thing in all of this is peer-to-peer. learning and a peer-to-peer approach. This is not a central program. It's not a central project. It doesn't have set formats. And what we found was that some of our managers picked it up and ran with it even before we'd finished telling them about it. Other managers have found it really difficult to engage with, not really sure what you want me to do. You haven't told me what to do. So what we realized early on is what we needed to do was just to create an open a community approach where everyone benefits from each other's ideas and creativity. So since the start of May, we've been doing monthly calls. All of our managers join those calls. They break out into little breakout groups, and they basically just tell each other what they've been doing. That's it, simple as that. And then we come back into a plenary, and then we ask the groups to share, you know, what did your group talk about? What did your group talk about? And then hopefully those managers that are a little less certain about the whole thing, they pick up the buzz, they pick up the energy, they pick up the vibe, they pick up the creativity of others, and they start to run with it. So this is very much about a community of teams recuperating itself, helped by St. Peter's through a bit of time, bit of money, a bit of guidance, and a bit of permission. But it's really about the community of teams, the community of managers recuperating themselves. I'm not really normally one for analogies, but I couldn't resist this one. The way that you recuperate a reef when it's been a bit decimated by pollution is you put those really simple frames in, very simple metal frames, and then the reef goes through the frames and flourishes. And so that's what we're trying to do. We're trying to put a simple framework together, give people permission around time and a bit of money, and then let them grow as a community of teams so that they start to flourish again. So the idea there is you go from the barren wasteland reef top left, and you end up with a lovely flourishing reef where people and teams have moved from a pretty tired and exhausting place to a much more resilient and flourishing place. I've just put those on the slides because obviously I'm happy to help anyone at any time. We have been working with a chap called Hugh Ward from Resolutions. He's been doing it pro bono for us, but he's been doing a lot for us pro bono. So I don't know how long you can keep that going, but he's available. And obviously we've got our own folk that work with corporate guys on it. So that's it, really. That's what we're up to at St. Peter's. We offer it as a kind of free resource for anyone to do with as they wish. And we're always happy to help give feedback on what we've been up to.
Thank you very much, Frank. That was fascinating. Excuse me. I particularly liked the person who brought the copper piping and the valve assembly in to demonstrate. Just I felt it tied in so well also with what you said about doing this over time. Don't try to do this on, you know, by Wednesday tea time. It's got to be done steadily, and it's a rebuilding process. I was enthralled. I'm guessing everybody else was, because there's nothing in the chat box, but I'm hoping that people will have some questions for you now. Anybody, anything they'd like to ask, or any comments that they'd like to make? Yeah, hi Tanya, do come in. Hi Tanya, would you like to say your question? Hello. I can't hear you, Tanya.
Your mute button's gone off, but we still can't hear you.
Is it a question you can pop in the box, maybe?
I think that, Angela, whilst we're waiting for Tanya to kind of type it in, I made a comment about mixed teams, and the challenge with mixed teams is really what this recuperation decompression is all about. It's about people that have experienced a shared experience, finding a way through to recuperate, decompress, and get on with what's next. And that, our view is that's best done in teams, because if you start to mix teams, you'll have people that have got very different experiences. So I was chatting with the chair of, I think it was MBT, and she was telling me about the Schwartz rounds that the NHS have been doing. And Schwartz rounds is, as I understand it, I don't really know, but they come together as multidisciplinary teams and they review what's happened. And they've been finding a lot of resentment bubbling up in those meetings, because you've got clinical staff that have been working really hard and think that they've been on every day, and et cetera, and those meetings have become quite challenging. Well, those aren't going to help you recuperate. So if you want to recuperate, you need to do that with people who have experienced the same thing as you, which is why we encourage everyone to do it within the teams. That's not to say at some point you don't need to kind of focus on bringing everyone back together, but I think we're certainly in St. Peter's, we're at a stage where we need to recuperate the teams, and then once we've done that, then we'll go back to kind of building the whole hospice back.
Thank you. Laura, in response to your question, where can we find the resources? We'll put Frank's slides up. I'll get them to everybody. Is there anything else you can add, Frank, in terms of resources? And Tanya has now kindly put her question in the box.
Yeah, I can share the, we've got a short, what is it, 3.5 page document, which is our guide to managers, and is the thing that they can reference in order to get money and take time. So I can make that available as well.
Thank you. Just to read out Tanya's question, I'm head of a special school. Majority of staff only work 8:30 to 3:30, which leaves only a small amount of time when staff aren't in.
Students aren't in.
Sorry. Yeah.
She's put a little thing at the bottom.
Yeah. Do you have suggestions for when I could build this into the day?
Yeah, I guess that's the problem that we've all got. I mean, I'm in the same building as our inpatient unit, and they're running their shifts, and obviously the community nurses have got their workload, which has not gone down at all and isn't improving in terms of, there's so much out there gap-wise in terms of normal NHS services. So this is the perennial problem. But for example, so there are examples that Sandra was hinting at, where you use existing meetings and you just build a bit of time in. Now, whether you can build 10 minutes in or 30 minutes in, we've done it a couple of times in exec where we've put an hour at the front. We've taken an hour out of the exec meeting and we said, right, okay, that we're going to put an hour to this, and then we've had a gap. So you can use existing meetings, breaks, staff breaks, certain amounts, and also, but if you've also got staff, certainly schools tend to have kind of staff socials at the end of term and things like that. You can kind of develop them a little bit. I think but the other important thing is that business of people knowing that the organization is in a period of recuperation and decompression, because then you can do all these little things, but then it has meaning for them. And whether it's 5 minutes in a meeting or a separate meeting or a separate social event or one of the social events you've already got planned, it all kind of fits into the framework of what you're trying to achieve. Yeah, so if you're tight for time, it's just a question of trying to be creative with how you build it in, and more little and often is often better than big set piece events.
Thank you. That slightly ties into a question I wanted to add, which is the vexed question of working at a lower pace.
Yeah.
And I think that probably links. Tanya saying thank you. Glad it was helpful, Tanya. I guess you would be echoing my thought around working at a lower pace, and I guess that's partly about permission, isn't it? It's about the formal element of the management have said we're in this period, this is allowed, but it's how you put that into practice.
Yeah, and I think it can't be done centrally. You can't decide that as a hospice we're all going to work at lower pace, because actually, if the retail teams who have been furloughed 3 times and only really went back to work on the 12th of April, they are absolutely buzzing and going at 1,000,000 miles an hour, and there's nothing they want to do to work slower, because they've been thoroughly bored on furlough, waiting to come back in. Whereas a lot of the community teams, they actually need a bit of relief. So it is down to teams and to managers to find. But in my experience, it doesn't take much to feel a bit of relief. You might do it as a manager without telling them why you're doing it. You won't get the effect. If you're doing it within a period of recuperation, you say, look, we're in a period of recuperation, we're going to try and take the edge off things. Then again, you get that multiplier effect. So for example, down in the inpatient unit, maybe just slipping a few education training periods and doing a bit of reflection. So instead of having to kind of do something that's work related, you do something that's more recuperation related. So yeah, that sort of thing really.
Thank you. I also liked what you said about the anonymous thank yous. I thought that was really lovely. I loved how you really weren't sure about it at the start, but the way you held up your lovely butterfly there showed that, yeah, you've moved on that.
Well, now over the last year, there've been a couple of occasions where people have dropped me little cards or notes and say thank you for a particular thing. I kind of look at it for a couple of days and then chuck it away and it's gone. Whereas this thing's going to be here forever. I don't think I'm ever going to get rid of it. And all it says is thank you. I've got no idea why.
Yeah, it's fascinating, isn't it?
Those anonymous thank yous, I think that's one of the better ones, to be honest.
Yeah, yeah. Anybody else got any questions? If I could just, I'm conscious that Sandra's come off mute anyway. I'm conscious that you need to go soon, Sandra. I just wondered if you had any further reflections. I'll let you speak because you've come off mute. You obviously did have something to say.
Yeah, I was just going to say, just echoing what Frank has said, it's not just, once you start doing this, it does become quite natural. And I must admit, when I first heard it, the questions I was asking Frank were about, or how do we fit it in? What's the structure? And I think to make it quite natural, it does then just flow. But those thank yous that Frank is talking about, because not everybody, as I say, is a verbal contributor. So we do have the way it's been adapted on one of our sites is things like Frank's Butterfly. They've got cards that say, oh, you're great, you're awesome, thank you very much, that they can just take and they can give out to each other. And also staff recognition cards where they can just say, oh, I've had a great shift today with, Mary or whoever it is, and they pin them up on the board. So they've got a staff recognition board. So it kind of all links, but it all kind of cascades into other things. And it does, because well-being at the moment, we're finding that now is quite a crucial time with well-being. We are finding that people are really struggling at the moment and are really, really tired. So it has come just at the right time.
Thank you. I think that I'm conscious David's got his hand up, and Tanya has added something else in that we've had less health professionals in school as a result. Our learning support staff are having to take on these roles. How do we allow for reduction in time without them feeling like they're letting the students down?
Yeah, I think, for most folk, whatever their work, they're supporting people. Our finance team are supporting from the back office. Obviously, clinical teams are supporting patients. There is always a bit of a sense that you can't afford the time. But obviously, I can't answer that question because it's down to teams to figure it out for themselves. That's the joy of this program. It's once you get engaged in it, you get more and more engaged in it. More and more ideas come up. The only thing I'd say is, and I reflect on a conversation I had with our chair about putting money aside for each member of staff to access. Our sense is that if we don't do this, we're going to have trouble. We're going to have staff leaving. Those that stay are going to be in a much less healthier condition mentally and physically, and they won't be doing such a good job for their patients and the families. So our view is that this is very much just as important as any other action and activity that we do in order to get through what we've been through and carry on performing at the highest possible level. It's an essential activity.
Indeed, yeah. Thank you. David, your go.
Yeah, thanks, Angela. I just wondered, Frank, has any of this work been explored in relation to doing things virtually or remotely? Your talk is very much around, I think, people being able to do that almost next to each other, as it were. Has there been anything around doing this virtually or remotely?
I think there's some certain amount has been done. Teams have done a certain amount of reflection and learning, for example, remotely, but it never feels as good. You know, Sandra's example of people being in the room together for the first time, and you know, her comment about how that felt, I think that is a reflection of most folks. So we've got, I'm conscious of being recorded, so I won't say the names and the teams, but we've got a team here where fairly senior executive level person running that team, and they've been through real difficulty. They've been under pressure. Relationships have got tough, at times a bit fractious. On a recorded event, let's not take it any further. And they did a recuperation session. They went out onto the downs. They got a picnic. They did some games. They sat down and did some learning as well. And literally the next day they were a different team. And they've all said it. It's just been like a coming together. It's been like a family reunion, to nick that phrase from Sandra, and it's just been utterly changed everything for them. And I don't think they would have achieved that virtually.
Thank you. I guess also this is the recuperation, decompression in the context we're living now is very much about how people haven't been able to be together, isn't it? That's one of the things we're seeking to mend, although obviously in social care the teams have been working together. Tanya has a follow-up. Would it work if staff are being given the autonomy to plan their day more effectively with a framework to support in the form of a risk assessment?
Yeah, that's an interesting question. I don't quite understand it. Obviously I don't work in school, but I think my best answer is that we are very much giving managers and teams the autonomy to think about this. And I would say that actually I think where it's worked best is where managers haven't done it on their own and sat there and thought, what am I going to do with the team? It's worked best where managers have actually got the team in and said, hey team, here's the framework, what are we going to do with it? And then the ideas come from the team. And then the more you do that, do it once, actually people see that it works quite well. And the more reluctant guys think, oh, actually, that's not such a bad idea. And then it builds and builds. So I think autonomy is a really important part of it. But within that, you've got to give them the framework of permission to do it. I think in terms of, I think I get where you're coming from with that question, Tanya, in that if you are reducing time and there is an impact of that, then you'll need to assess that. And in the same way that down on the inpatient unit, in order to fit some of this in around the shifts, there may well be times when there's less people out there, but they're not off site, so they are able to take a risk assessment approach to making sure that they're not adversely impacting patients. I'm not sure whether I've answered that properly. Sorry.
While Tanya digests that, one thing that very much interested me as well, it all interested me. I'm an HR person by background and profession. Always interested in what's going on for people. And I think one of the key things here is that it's a right thing. It's not something we're going to do in a longitudinal sense. It's very time defined. Can you talk to us a little bit about that? Because I there might be some things that people that I can hear teams go, this is brilliant, we ought to do this all the time, and there will be learning from it that people will apply on a more long-term basis, I suppose. But can you talk about the fact that it's very time defined and there is a beginning, there is an end, and what that is?
Yeah, I think the first thing to say is that it's a fairly long time definition. So we're taking 4 months. Actually, we were engaging our managers around it in February and March and April because we were thinking about it and developing ideas. And we had a couple of managers sessions where we introduced the idea and they, said, what do you think? And so we took a little while to develop it. But then we we did go live with it in April and said, right, we're kicking off with this at the start of May. Money will be available, and you can take, you are empowered to take whatever time you're able to take within your team to do that. But we do want it to end. We are giving people 4 months. The money, we can't just throw money at it all the time, so the money will have to end. And also we do think that the period through the summer is ideal for this sort of thing, but it can't just go on indefinitely. But we do agree with you, Angela, that we think that this is now something that we will use repeatedly. And I suspect we will use it at the end of winter. And I think we will use it as a kind of spring to reflect on the end of winter and to kind of recuperate and decompress ready for the summer. But actually it will probably be shorter. It might be that in a normal winter, we do this over April, for example, that sort of thing. So I don't think it's a one-off, absolutely not. But I don't think you can just let it run indefinitely, because recuperation and decompression is something that you need to get through and then move beyond and get back to normal life type thing. So I do think you can carefully manage it so it happens, but in my view and experience, it does need to come to an end. Thank you.
I'm just noticing that Sandra's added an additional comment that it to be borne in mind is a readiness to support members with the impact of their reflections. She says everything we've been through during COVID, and thinking about that can open up other historic issues and anxieties. So we have to be ready to support this. And that, Sandra and I must be telepathic, because I was actually just going to come in with how this links with employee assistance programs and those other things that are going on, wellbeing support stuff that pre-exists or is in existence, hopefully, in organizations. This is a supplement to that, but it may then feed into those necessarily for some people who've had some very difficult experience, as well as being exhausted, actually just exhausted.
I would say that Sandra's reflection probably exactly matches every session that we've held at St. Peter's, where some people, it is great where the team manager or the leader or whatever leads, because it does help to give permission and encourage and create that safe space. Look, if I'm prepared to share it, then feel free. But there will always be folk that aren't able to, or maybe not prepared to, or both. And there will always be those folk that are forward leaning and wanting to. And I think you've got to just be open to people being free to engage or not. But the important thing is to create the safe space so that they have that. But you're right. The thing that got us onto this was back in January, February, where we were noticing in the hospice, there were certain individuals who were beginning to behave in a way that they've not behaved the previous year. In other words, cracks were beginning to show. And these were folk that on a day-to-day basis, you'd say, no, they're pretty good. They've been fine. So I think you've got some people that have found things difficult and, probably have accessed services already, like employee assistance, clinical supervision. But then you've got other folk who you think, oh, do you know what? They've been great. And some of those will never need assistance, but some of them probably do and just don't know it yet. And so what this thing does is it helps perhaps to bring some of that out, and then they can be signposted to that support.
Yeah, thank you. Gosh, I could pepper you with questions for the rest of the day, which is very unfair. I see Siobhan has put in the chat box that she's nothing to ask, but she's grateful for all that's been said. So thanks for that positive feedback, Siobhan. Has anybody else got anything rather than it being all about me? No.
Great. Well, it's a free resource. I hope it's of some use. If when you're using it, you've got any further questions, always available.
Thank you very much. And we'll put those resources up. And so I'm going to turn off the recording.